Okay, so here's the deal. Your legs are super important for getting around, but what happens when they're blocked? Not good. That is why it is essential to understand the different types of clots that can occur in your legs, their sneaky symptoms, and how docs figure out which ones you've got. We'll even show you how clots are treated, so stick around and let's get to it. Alright, so first up we need to talk about the two main types of clots and how they affect your legs. There are two main types of clots, arterial clots and venous clots. Here's how they work and how they show up in your legs. So with arterial clots, these bad boys form in your arteries, which are the blood vessels that carry oxygen-rich blood away from your heart to the rest of your body. Your legs get their supply through the aorta, which branches into smaller arteries like the femoral artery in your upper thigh. Arterial clots can happen anywhere along the way, and they can partially or totally block the blood flow, which is not good because it means less oxygen and nutrients are getting to your legs. And when they block the blood flow entirely, it becomes a medical emergency since the affected limb will quickly begin to die without blood. Now on the other hand, we have venous clots, also known as deep vein thrombosis or DVT. These clots form in your veins, which are the blood vessels that bring blood back to your heart. In the case of your legs, the superior vena cava is the big vein that carries blood from your lower extremities back to the heart. Along the way, there are smaller veins like the popliteal vein in your knee and the femoral vein in your thigh. Venous clots can also happen anywhere along the way, and they typically don't cause any noticeable symptoms, which is why they're so sneaky and dangerous. If a piece breaks off and travels to your lungs, it can get lodged in one of the arteries and block the blood flow, causing a pulmonary embolism. This is a medical emergency and can be fatal, so early detection is key. Moving on to the symptoms, it's important to note that some people with clots have no symptoms at all, especially with venous clots. With arterial clots, the symptoms tend to come on suddenly and can be pretty severe. Here are some things to watch out for. First, you might experience a sudden severe pain in your leg, often described as a deep, aching, cramping, or throbbing sensation. The pain might be worse when you walk and may even radiate to your foot. Next, you might notice that the skin in the affected area is cold, pale or bluish, which means that the blood isn't getting through properly and the affected area isn't getting enough oxygen. You might also feel warmth or redness over the affected area because of the blocked blood flow. Your pulse in your foot might be weak or absent, which is another sign that the blood isn't flowing normally. And finally, you might feel tenderness or pain when you touch the affected area, especially if it's swollen. If you experience any of these symptoms, it's important to seek medical attention right away, because it could be a sign of an arterial clot, venous clots. On the other hand, the symptoms are more subtle and often go unnoticed. However, there are still some clues to look out for. First, you might notice swelling in one of your legs, usually below the knee. And it's important to note that the swelling will be more prominent at the end of the day and might be relieved by lying down. The skin might feel warm to the touch and appear red or bluish in color, and you might also feel a pulling or aching sensation in your calf or thigh. These symptoms might not be very noticeable at first, but they're important to keep an eye on because, if left untreated, the clot could travel to your lungs and cause a pulmonary embolism, which is a medical emergency. Next, let's talk about how doctors diagnose clots. They use a combination of tests and procedures to figure out what's going on. For DVT, the primary test used to diagnose clots in the deep veins of the legs is ultrasound. It's non-invasive, painless, and provides real-time images of the blood flow in the veins. In addition to ultrasound, doctors may order a dimer blood test to check for fragments of clots that have broken off and are circulating in the bloodstream. However, it's important to note that a positive dimer test doesn't necessarily mean that you have a clot because the results can be elevated for other reasons too. On the other hand, if there's a suspicion of arterial clots, doctors might order a CT angiography or MR angiography to take detailed pictures of the blood vessels in the legs. Doctors may also order a Doppler ultrasound to check the blood flow in the arteries and see if there is any sign of a blockage. And finally, let's talk about treatment options. The treatment of clots depends on where the clots are located and how severe the symptoms are. Both arterial and venous clots are treated as medical emergencies. If you have an arterial clot that is blocking blood flow and has caused symptoms, emergency care is needed immediately. This is because the affected limb is not getting enough blood and will quickly begin to die without treatment. The goals of treatment are to restore blood flow and prevent further complications. For arterial clots, this often involves surgery to remove the clot or bypass the blockage. In addition, doctors will prescribe clot-busting drugs, also known as thrombolytics, to dissolve the clot. These drugs work by breaking down the components of the clot and restoring blood flow. One example of a thrombolytic is Alteplase. The choice of which drug to use will depend on the severity of the symptoms and other factors such as the patient's overall health. For venous clots, anticoagulants, also known as blood thinners, are the most common treatment. These medications prevent the clot from growing larger and reduce the risk of further complications such as a pulmonary embolism. Anticoagulants can be administered intravenously or orally, depending on the type of medication prescribed. Some examples of anticoagulants include heparin, warfarin, and DOACs, which are direct oral anticoagulants, such as rivaroxaban. In some cases, doctors may also recommend wearing compression stockings to prevent swelling in the affected leg. And if blood thinners aren't safe or effective, doctors might consider placing an IVC filter. This is a device that gets inserted into a large vein in the upper leg, and it acts like a net to catch any clots that might be traveling to the lungs. In addition to medications and devices, lifestyle changes can also play a role in preventing and managing clots. One of the most important things you can do is move regularly. If you're on a long flight or sitting for an extended period of time, get up and walk around every 2 hours to improve circulation in your legs. Staying hydrated is also important because dehydration can make your blood thicker, increasing the risk of clot formation. Make sure to drink plenty of water throughout the day, especially if you're traveling. It's also essential to be aware of the risk factors for clot formation, including smoking, obesity, pregnancy, birth control pills, and a family history or prior history of clots. If you have any of these risk factors, talk to your doctor about ways to reduce your risk of clot formation. Finally, pay attention to your body and don't hesitate to seek medical attention if you notice any unusual symptoms in your legs, especially if they come on suddenly. Remember, it's always better to be safe than sorry. Now, here's a situation that you should never do. Never massage a swollen leg. Even if it's not your leg and you see someone who has a swollen leg, don't try to help them out by giving them a massage. Instead, tell them to go see a doctor. Why, you ask? Well, because the swelling could be caused by a blood clot. And when you massage the area, you could dislodge the clot and send it to their lungs, which can be fatal. Here's another question we often get asked. When should you call 911? If you think you might have a clot in your leg, it's important to know when to call for emergency help. If you have an arterial clot, call 911 right away. Arterial clots are limb-threatening and require urgent medical attention. On the other hand, if you suspect you have a DVT, don't wait. Call 911 and get yourself to the nearest emergency room within 24 hours. The longer you wait, the higher the risk of the clot traveling to your lungs and causing a pulmonary embolism, which can be life-threatening. Okay, so now let's wrap things up with some key takeaways. First, arterial clots are fast and deadly, while venous clots are stealthy but dangerous. Second, ultrasound is the main tool for diagnosing DVT, while CT or MR scans are used for arterial clots. Third, blood thinners are the primary treatment for DVT, while surgery is often needed to remove arterial blockages. And finally, prevention is key. So move, hydrate, and know your risk factors. By understanding the different types of clots, their symptoms, diagnosis, and treatment, you can take steps to keep yourself and others safe. Do you not forget to share this video with your friends and family so they can stay informed as well? Remember, knowledge is power, so keep learning and stay healthy.
Thanks for watching.